Hi, everyone. My name's Josh Furstenberg, and I'm a senior director here at Verato. I'm responsible for customer success and renewal. I work closely with customers like Megan, who we'll hear from in just a minute, to help them modernize, transform, and achieve their objectives. And we do that with a powerful platform known as Verato. Verato really helps healthcare organizations unify, resolve, and enrich patient, or I should say person and provider information. And we do that so you can create a foundation to deliver care, empower performance, and deliver accurate, actionable analytics and AI. We are the only healthcare-powered MDM, purpose-built, backed by a patent-pending referential capability. It's truly remarkable how matching with an answer key can really bring dramatic changes to an organization. And so I'm here with Megan to talk a little bit about how identity and when the experience of a consumer or patient breaks, what happens? Megan, do you want to tell us a little bit about yourself, a little bit about what you do, and a little bit more about Opala?
Sure. So I'm Megan Quint. I'm Senior Vice President of Product and Customer Success and a founding employee of Opala. Opala is an interoperability partner for payers and providers. And in addition to focusing on regulated interoperability capabilities, we also support population health analytics and value-based contracting and AI enablement. So we really serve as sort of an external data hub that allows payers and providers to exchange data with each other and with other external data partners in the healthcare ecosystem. And the reason that identity is so important when you're talking about interoperability is because we have to first and foremost be able to answer the question, are we talking about the right person before we exchange any data about that person, especially in the healthcare context. And I know we'll talk about that a lot more. So for us, Verato and our partnership with Verato is more than a part of our tech stack. Certainly, it's not just a capability that we've tacked on to our platform, but it's actually a fundamental capability for establishing and maintaining trust in data for our customers.
Wow, that's great. Thank you for sharing that. And I really appreciate you being here. I'll just start off with a quick anecdote. Sometime pre-pandemic, I was speaking at a conference. It was the last day, and there was only one other person in the audience. So I asked them, why are you here? And they said they were the speaker after me. So I really enjoy the idea that I'm not the last speaker, and I really appreciate everyone sitting here in the audience with us today to learn a little bit more about interoperability and ultimately the patient experience. So thank you.
And if you are the speaker after us, please don't let us know that.
Precisely. We heard a lot this week about interoperability. We've heard a lot about the demand side of patient data and really the supply side, how those are coming together. And I guess we'll spend a few minutes talking about like what happens when there's a break in that demand side, right? When consumers don't have the experience, when the workflows don't happen, right? What's at risk, right? And so that's really what our session is designed to talk about. And I'm really, like I said, grateful that you're here today. So my first question, Megan, is what makes identity-driven interoperability such a critical problem, all right? And how does it impact your customer experience, both in terms of the care delivery and the trust that your customers and their patients have in them? What does that mean to them?
Yeah, so first it's worth noting that enterprise identity is hard. And when you start talking about cross-enterprise identity, it's exponentially harder. So, and yet CMS is requiring these longitudinal patient records that string identity, link identity across these various healthcare contexts. So, why is that so hard and why does it matter? When you get identity wrong, you can't come back from that. You don't get a second chance. When you do outreach to the wrong person, for case management, or, you expose a medication list to the wrong person, Or, even worse, there's a potential patient harm or patient safety issue because the wrong information is either in the record or not in the record. These stakes are so high. So, identity mastering really is a prerequisite to compliant and secure data exchange.
You're absolutely right in the difficulty. It is really hard to master identity. Doing it right takes perseverance and a commitment, data governance, tools, technology process, and the like. But getting it wrong, as you described, right? Really, you don't get a second chance sometimes to make that first impression. And in many cases, it can be consequences that are financially driven or legally driven. So it's worth the effort for sure. Tell me, how does Opala leverage Verato to solve that challenge? And how does it help both Opala and your customers, but the ecosystem as a whole?
Yeah, so for us, it's really important that we have a pristine data layer before we do interoperability so that we're not just perpetuating errors all over the place. And I'm sure we'll talk about that a little bit more later. So we leverage Verato's MDM cloud for that probabilistic match in real time. And then what that allows us to do is have flexibility for our customers around identity mastering on top of that. So, for example, we're able to do things like apply business logic around linkages. We're able to do things like, understand different confidence intervals that our customer might have, so that essentially what we have at the end of the day is a way to master identity based on the customer's unique risk profile for that use case. And it's not just a one size fit all.
So it's not just about unifying the data, right? You're actually taking action from the insights that you're learning and engaging the patients and consumers on their journey.
Yeah, that's right. It's about mastering the data, linking the data when we know it absolutely certainly should be linked, and being cautious when we're not so certain it should be linked. And how you deliver that probabilistic match to those downstream operational systems really depends on what that data is going to be used for, and the trust threshold, the confidence threshold that won't break the trust in that data.
We're definitely going to talk about trust in a follow-up question in a minute, but I am curious to understand, what measurable improvements are you seeing and are your customers seeing thanks to Verato's approach?
Well, the first and most obvious is fewer identity errors downstream. And, while that is obvious, that means less disruption to operational systems, less waste trying to roll things back. Of course, trust, but also faster onboarding of new data sources, which is really relevant when you're talking about implementations that can take months, and now we're talking about weeks or days, because we can solve for that identity quickly and efficiently. Really, what it does is it accelerates decision making. And that's the real impact is, with that trust in that identity and in the data that comes along with that identity, now decisions can be made quickly. And for us, as we're really focusing on data exchange between payers and providers on behalf of the patient, so that the patient doesn't have to be accountable for making sure all of their data is exactly where it needs to be in the healthcare ecosystem. What it means is that payers and providers are now willing to exchange data for more use cases because they feel confident that they're not going to have a HIPAA breach because they've shared data for the wrong person, or they're going to have a lawsuit or a reputational issue because the wrong data was exposed.
So confidence in the data it grows with every use. Right?
That's right. Confidence, and then more ability to use it because there's trust that the data is actually accurate.
That's excellent. Who's making those decisions?
That's a great question, and it varies. Particularly at health plans and pay and provider organizations, there tend to be multiple stakeholders that weigh in on things like this. So, we always are working with a technical team. There's a certain technical and data standard that we need to prove the reliability and the soundness, the robustness of the solution. But really, the value is realized by folks like the chief medical officer or somebody responsible for value-based care, value-based contracting, or population health. Because when you can actually combine payer data with clinical data, you now have a much more complete picture of any patient's healthcare journey. I think of the claims data sort of like the skeleton or the backbone of a patient's healthcare journey because it has breadth, especially when you're stringing together coverage across time, right? You can see all of the providers that patient has visited. You can see all of the prescriptions that they actually filled, not just the ones that were written. But when you get into the provider data and the EMR, that's where you get the richness of the record. So there's data in there that the payer never sees on a claim. So things like vitals, things like lab results. This is really important information for a payer to have if they're going to be able to offer population health resources to those patients or do any sort of case management outreach.
So you mentioned some of those decision makers. Are they also the first people that call when that experience breaks?
No.
Not necessarily.
Usually, the stakes are very high if the data is incorrectly attributed by identity. So there will be lawyers. And most likely that would be who would be dealt with would be a lawyer, unfortunately, because really, the stakes are truly that high.
Yeah.
You can't mess this up.
That makes sense. We talked a little bit about risk. And so when organizations, don't deploy mastering technology, interoperability suffers. But what would you surmise is sort of the impact to data quality, to care coordination, and to the whole concept of trust that we talked about earlier? Like, sure, it's less, but surely people have gotten around without it, right?
Yeah, what happens if you do interoperability, I touched on this at the beginning just a little bit, but if you do interoperability without proper identity management, what ends up happening is that you're essentially scaling risk faster than you're scaling value. So you're spreading this data all over the place that isn't necessarily accurate and reliable. And, we already have a problem in healthcare of too much data, right? So now you're just perpetuating that problem where you've spread more data that's not necessarily accurate. So even the data that otherwise would be reliable is now sort of in doubt. No one knows which data to trust and which data not to trust. It's a very dangerous situation. And in terms of risk, you're scaling reputational risk, certainly. You're scaling risk around outreaching to the wrong person, like I mentioned before. That is not a good thing when either your provider or your payer calls you because they think you've been newly diagnosed with something that you have not been newly diagnosed with and don't need to be in that particular program or need those resources. It's very unsettling when you cannot trust your healthcare system to actually know you and know your healthcare situation.
And so obviously there's great responsibility when you have great access to data. Not to pull on Spider-Man, but I guess I'm curious to understand, like, organizations that are trying to decide between doing something and not, right? It seems as though the risk profile exists either way, but you have a better shot of minimizing that risk and actually making the world a better place when you take action and do something to structure and govern the data, to master it, and to have it serve, like, not just the business operations, but the community, the population, the people that are involved. That's ultimately what we're trying to do, is make people healthier, live longer, and benefit from the great science and medical advances that exist today.
Yeah, that's right. I wouldn't necessarily say that there's risk on both sides. I think there absolutely is risk in doing interoperability without proper identity mastering. a lot of these interoperability data exchange requirements are not optional. So you have to exchange data on your members if you're a payer. So if you're doing that in a way where the identity has not been appropriately mastered, then you are accepting all of this risk, which is not risk that a health plan is generally comfortable with. So I think this identity mastering is absolutely a prerequisite to interoperability. It's not optional. There's not risk on the other side of doing it. Doing interoperability with proper identity mastering. I don't see risk in that. I see what you're saying, Josh, around better patient experience, which for sure we're here to talk about today, because the patient actually feels like the healthcare system that's supposed to be serving them knows who they are. That might be their provider, it might be their pharmacist, it might be their payer, but to actually feel seen for your own personal healthcare situation is unfortunately unique, and it's extremely powerful as a member or a patient experience. It's also a much better experience for a provider, right? To actually have data at their fingertips that they can rely on. I think it is absolutely crazy that healthcare decisions are really made on about a 3-minute conversation between a provider and a patient, where the patient is being asked to self-recall, from memory, while they're in a clinical setting, by the way, which might mean they're in pain, might mean they're sick, might mean they're traumatized a little bit. It might just mean they're nervous. That is not great for cognitive recall, any of those things I just mentioned. And yet, that is the main data source that is being used for decision-making at the point of care. Opala is on a mission to fix that, so that it's not the patient that actually needs to be responsible for telling the clinicians the most relevant, important information that provider might need to know to treat them appropriately. But similarly, on the payer side, we've got to fix some of these processes so that claims are not denied inappropriately, care's not delayed. There's a lot of emphasis this year on improving prior authorization. That's really important so that people can get the care that they need, and then have better outcomes because of it, and build that trust in the healthcare system again.
Thank you, Megan. One last question, and we'll be able to take a couple questions from the audience. What's next for Opala? Where are you headed? What's the future look like?
This is a compliance year, so we are focused this year on CMS 0057, which for those of you that don't know, that's Provider Access API and Prior Auth API requirements. So we are focused on that a lot this year. The reason I say that in a less enthusiastic way is only because I am most excited about interoperability for the purposes of lowering total cost of care, improving patient quality of care, like HEDIS scores and MA star ratings, and getting better risk capture, because that's really what powers population health and value-based contracting. So the good thing about provider access and prior authorization mandates this time around is that they actually will lean into that provider payer data exchange in a way that I believe will be impactful to patient care. So it is exciting, but it is another mandate wave that I really hope provider access in particular is adopted broadly by providers to improve patient care.
I often say Rome wasn't built in a day, but if it was, we all would have hired their contractors. But I'll tell you, one thing that they did do is they laid bricks every day. And I see that with Opala, right? Constantly fighting the good fight, making a difference for the world. And I appreciate you being here, Megan, to share your vision, your thoughts with the audience. Thank you. There is a mic in the center aisle here if anyone would like to ask any additional questions. We have about a minute left. Go
Hi,
ahead.
Josh. Hi, Megan. My name's Joe. Thanks for doing this. Really fascinating discussion. So I had a question as it relates to, and this is for Megan, as it relates to the interoperability that you mentioned between the payer data and the provider and clinical data. How is Opala getting that to be more aligned? And you talked a little bit about the risk of not getting it aligned, but how you're helping getting it aligned, and how that's benefiting specifically payers?
Yeah, so how we're getting that aligned is that we're working with payers and providers who already have a partnership with each other, usually because there's some form of value-based contract in place between them. So they are both incented to improve access to care for a certain population of people, quality of care for those people, to proactively manage the health of those people as opposed to just reactively wait for those people to show up in the healthcare system and treat them. So what that does is it brings this mutual goal between that payer and the provider. And what we're doing is going and getting that data that the payer has that's distinct from the data that the provider has, bringing it together so that we have one complete longitudinal record of a particular patient, and then making sure both payer and provider have that same complete, accurate, real-time data.
Thanks, Joe. Thank you, everyone. Megan, great to see you.
All right, thank you.
Thanks for
Appreciate
being
it,
here.
Josh. Thank you, Verato.